Eco India bra state laga health officials kan nimide today partner launch training conduct korise. Tweetin laga event do July 4 aro 15 Hotel Vivar Kohima di loblese. Ijo event do state laga healthcare journey de tangor milestone mark rate chun laga maksad to pura state de healthcare professionals kan laga capacity aro skills di paravati bonimide ase. Tweetin partner launch training bra district health officials kangi eco model de introduce kribo kute healthcare system do takra banabo nimide capacity building de emphasize kribo. Nagaland de Eco India bra tinta telementoring hubs established krigna se aro state's national health mission Kohima de state tuberculosis cell aro Nagaland nursing council de collaborate krishet. Inauguration ceremony the esteemed guests are speakers Kanahishe Kude Health Minister P. Paiwan Kunyak, Commissioner and Secretary Health and Family Welfare, We Kezo Aro NHM Nagaland Mission Director Dr. Ako Sore Kanbi Shamil Takshe. Detailed reports Sawo.
This gathering signifies our shared commitment to advancing the health of well-being of our state, Nagaland. The government of Nagaland has stuck fast in its focus on improving the lives of its citizens, recognizing the pivotal role that healthcare plays in enhancing overall quality of life. Significant investment has been made to bolster the healthcare infrastructure across the state. A prime example of this commitment of the government and every citizen of the Nagaland is the inauguration of Nagaland Institute of Medical Sciences and Research, that is NIMSAR, in Kohima. This institute is not merely a hospital, but also a beacon of research and innovation. The establishment of NIMSAR marks a significant milestone promising a tremendous upsurge of healthcare upliftment and development in the healthcare sector. The government's vision is to extend beyond the urban center. In the centers, there is a concerted effort to ensure that the knowledge and benefits at the center extend to the peripheries and reaches to the furthest corner of Nagaland. It is imperative that individuals in urgent need of healthcare can access to it promptly, without the burden of moving the patient across great distances, thereby saving lives, conserving both time and resources. The strengthening of health facilities, upgrading of the existing ones.
Every day is a learning stage, and we are here to learn, and we should thank God for giving us this privilege and opportunity. Eco India partner launch training in our state. As we are all aware that Eco India initiatives marks a significant milestone in our collective effort to bridge the gap in healthcare delivery and ensure that quality care reaches every corner of our state. I have learned insightful knowledge about the Eco partners within just a few minutes while I was sitting with Mr. Surajit Chaturaj. It is imparting knowledge to the rural where our health professionals will need to utilize and exercise the best mind, the best capabilities in order to treat the healthcare, in order to come to the rescue of the people living in the rural areas. At the same time, while involving in that method, we will also learn knowledge about the traditional method of health system in the rural areas. When Nagaland attained statehood, our health infrastructure was under-equipped, with limited access to advanced medical technologies and trained healthcare professionals. Today, healthcare facility in the state has been significantly enhanced in all district hospitals. We have TB, tuberculosis, and chase disease hospitals, a state mental health institute, community health centers, and our state's first medical college in the state capital. Construction of Mon Medical College is in full swing, and laying a foundation stone for nursing colleges in Kohima and Mon are in the pipeline. The priority of our state government has always been to provide comprehensive health infrastructure to all the citizens of the state, and our proactive approach is to ensure healthcare that is accessible, affordable, and available to all at the right time and in the right place. One of the key initiatives in this endeavor is the Chief Minister Health Insurance Scheme, designed specifically for the people of Nagaland. This whole scheme, launched in collaboration with the central government's Ayushman Bharat scheme, is a significant step towards achieving Nagaland's 2030 Sustainable Development Goal, which was launched in August 2021. This goal strives to guarantee that all citizens of Nagaland have access to fair, economical, and high-quality medical care by 2030. Department of Health and Family Welfare is contemplating to introduce more services under Chief Minister Health Insurance Scheme in the days to come. This will achieve the intent of comprehensive healthcare infrastructure in the state. Any permanent and indigenous residents of the state who are not enrolled in Ayushman Bharat or Development Goal, which was launched in August 2021. This goal strives to guarantee that all citizens of Nagaland have access to fair, economical, and high-quality medical care by 2030. Department of Health and Family Welfare is contemplating to introduce more services under Chief Minister Health Insurance Scheme in the days to come. This will achieve the intent of comprehensive healthcare infrastructure in the state. Any permanent and indigenous residents of the state who are not enrolled in Ayushman Bharat or any other publicly funded insurance program can be covered under Chief Minister Health Insurance Scheme. Nagaland, being a community-driven society, by involving community and imparting trainings, will empower primary health clinicians in rural and undeserved areas with the knowledge and support that they need to provide expert-level care. This standard of knowledge ensures that every patient, regardless of where they live, can receive the highest standard of care. It is about equity, empowerment, and excellence in healthcare. Today, as we bring this innovative model to our state, we are not just launching a program, but we are igniting a movement that will transform the health landscape in our state, making specialized knowledge accessible to all healthcare providers, irrespective of their geographical locations. Once again, I appreciate our Eco India partners, supporters, for coming forward to impart training to our dedicated healthcare professionals. Your commitment and patience for improving healthcare in India are truly commendable. In closing, I urge the healthcare providers to embrace this opportunity, participate actively in the eco sessions, and become a part of this transformative movement. Let us work together to ensure that every citizen in our state has access to the quality health care they deserve. Thank you. God bless.
Our tagline is very simple. Move knowledge, not people. Over the years, we've seen in each of the places where we all reside that people come to where knowledge is. They come to the specialist hospitals, they leave their livelihood at times, especially people in underserved areas, mortgage land, borrow money, and come to get the right treatment. And we started off with one man's vision of if that knowledge could be there where the patient is, how would it overturn this entire paradigm of treatment? Can we move knowledge rather than move people? So what is our aim? Our aim is to democratize knowledge. Our aim is to make knowledge available where it should be. That is the core seed from which the ECHO movement has grown. And that is what governs all of us. That can we shift the knowledge to where people need it? And ECHO uses technology to amplify the reach of scarce resources. And scarce resources are people who have the knowledge. And in those days, we used Zoom as a platform. And now we have our own platform called iECHO, which incorporates Zoom in it. You will get to know about it. So in 2014, suddenly there was traction because we could start doing video conferencing. So NIBHANS, NICPR and NITRD partnered with ECHO India to start their capacity building programs here. Our commitment is to sustainable development and community empowerment. We firmly believe that if the right knowledge is at the right place, it will deeply impact and change people's lives. We worked with programs like the COVID-19 Vaccination Confidence and Advocacy Program that was during the times of COVID to increase the trust in the COVID vaccination. We've also done the certificate course on tobacco control, training thousands of school administrators and teachers on tobacco laws, universal immunization program. Essentially, all of that has been honestly done by you all. We've just tried to be this catalyst and work through your efforts at reaching out and touching the lives of many people. And the more interactive these sessions get, the richer is the learning. And in ECHO, we always believe in the motto, all teach, all learn. So as much as we will try and share our learnings with you, we will also take back a rich trove of learnings and knowledge from you all.
Emporium Nagaland is India's premier aviation, hospitality and cruise line training and international job placement consultancy. Trained and blessed over 20,000 youths from Nagaland in prestigious international brands. The only institute in Nagaland that hosts top airlines, cruise and 5-star hotel campus interviews. The first institute to conduct international cruise campus interview in Northeast. We are open to students of class 10 and above. Emporium provides 100% placement assistance, empowering educated unemployed youths with global opportunities.